we are going to play medical detective. To master Robbins Chapter 6 Genetics, you must be able to look at a family tree or the pedigree and diagnose the inheritance pattern instantly. We will walk through two classic clinical scenarios, hemophilia A and Marfan syndrome. Case study 1. The bleeding boy, hemophilia A. Let's look at the clinical scenario. A 4-year-old boy, Rohan, is brought to the clinic with massive swelling in his right knee after a minor stumble. His mother mentions that her father, Rohan's Nanaji, died young due to a bleeding disorder, and her brother, Rohan's Mamaji, also has frequent joint swellings. Let's map this out using standard symbols. Squares as males, circles as females, shaded as affected, and dot in the center as carrier. The disease skipped Rohan's mother. She is healthy, but her father and her son are affected. Let's make our first observation. The disease skipped Rohan's mother. She is healthy, but her father and her sons are affected. So the rule was, if it skips a generation, it is recessive. The second observation would be, only males are affected in this family. So the rule was, if there is a heavy male bias, think X-linked. Observation 3, the clincher. Rohan's father is perfectly healthy. And the rule was, in X-linked recessive, the bad X comes from the mother. So this is an example of X-linked recessive inheritance. Let's integrate this with biochemistry. Mutation in the F8 gene causes deficiency of coagulation factor 8. In pathology, you'll see a prolonged APTT, intrinsic pathway defect, but a normal PT and bleeding time. So moving on to medicine, the treatment involves factor 8 replacement. Never give aspirin to these patients. Case 2. The tall teenager, Marfan syndrome. Let's look at the clinical scenario. Aditi, a 16-year-old girl, stands 6.1 feet tall. She has very long fingers, arachnodactyly. Her father is also very tall and recently underwent surgery for an aortic aneurysm. Her younger brother is starting to show similar features. Let's draw the pedigree. Now let's make few observations. Observation 1. There is no skipping. Aditi has it, her father has it, and her brother has it. The rule says vertical transmission means dominant disease. Observation 2. Both males, father and brother, and females, Aditi, are affected. The rule says if there is no sex bias, it is autosomal. Observation 3. The risk for the next child is exactly 50%. So it all boils down to autosomal dominant disease. Let's integrate this with anatomy or histology. There is defect in fibrillin 1, which is a scaffold for elastin. Look for cystic medial necrosis in the aorta. Integrating it with surgery, the biggest threat is aortic dissection. In ophthalmology, look for ectopia lentis, which is upward dislocation of the lens. Remember the Steinberg sign, the thumb sign, and Walker-Murdoch sign, the wrist sign, for your clinical exams. Here's the cheat sheet for your exam comparing hemophilia A, which is an X-linked recessive disease, and Marfan syndrome, which is an autosomal dominant disease.